Hello friends, I'm Dr. Swati Kanakia, a Pediatric Hematologist Oncologist at the Lilavati Hospital and Research Center, Mumbai. Let me tell you about an incident that happened just last year. A patient took an appointment, cancelled it, took another appointment couple of days later, again cancelled it, made an appointment the third time and cancelled it. 3 months later, a patient came into the clinic. The name sounded familiar, but I couldn't place it exactly. I was going through the reports and I realized that this was a very stage 4 kind of disease. It had spread to all the organs. And as I was going through his papers, I realized that 3 months ago, he had done the same investigations, and that time the disease was localized. So I just looked up at him, and the father said, ma'am, we had taken your appointment a number of times 3 months back, but we thought that the child wouldn't be able to tolerate the side effects of the treatment and the chemotherapy. So we decided, to take some other kind of remedy. So here we had a patient who was actually a stage 1 child who could have gotten away with very little minimal chemotherapy, and now he had come to us 3 months later with florid disease, a disease which had spread all over the body and would require much more chemotherapy and perhaps not such a good outcome. So we went on to treat the child nevertheless. The child is doing very well. But all patients may not be so lucky. With a more widespread disease, as you can understand, the treatment is way more aggressive, side effects are aggressive, long-term side effects are much more. So there's just one message that I want to tell you all today on occasion of the World Cancer Day, is that if your child or anybody that you know has got cancer, take them to the clinic immediately. Don't worry about the side effects. The doctor will manage all that. But don't let a simple disease get converted into a difficult disease. And also remember, friends, that most childhood cancers are very well treatable and curable, and therefore get them to the clinic, to centers of excellence early, so that you give a good chance to the child as well as to the doctor. Thanks for listening.